Okay, that's a good start. That's worked. So, evening, everybody. My name is Lucy Dentist. I am program manager at the NHS Clinical Entrepreneur Program, and I also help run the new patient program and also our brand new Dementia Innovators program. So, hopefully, you are here tonight because you are interested in one of those programs. You're looking to apply, you have questions, and you really want to join our next cohort. So, with me tonight, I've actually got two members of our team, so I'll just let them briefly introduce themselves. Emily, do you want to go first?
Hiya, I'm Emily Lloyd. I'm the Communications and Engagement Officer within the team, so I work closely with Lucy. And if you get on the programme, I will probably pester you for case studies, videos, and profiles and bits like this. So lovely to meet you all.
Tamsin?
Hi, I'm Tamsin. I work as a paediatrician in Cambridge, and I have been on the programme myself. And then later, a few years later, I joined the team. So I've been on the clinical entrepreneur team now for just over 3 years.
Thanks, Tamsin. So we're going to hear a little bit more from Tamsin in a minute. But as I said, hopefully you're here because you have questions about the programme or the application process. We're not going to do loads of slides tonight. I've sent you all a slide pack, so you should have that. And that just gives you a little bit around application tips as well. And there is plenty on the website actually about the programs. But thought what I'd do is just make sure you have a brief overview for each program and what it's all about. So we'll start from there. If you've got any questions as you go along, please just pop your hand up or open up your mic and just ask away. So here goes. So welcome. So we are actually out for recruitment for cohort 9 of the NHS Clinical Entrepreneur Programme, cohort 2 of the patient programme, and as I said, cohort 1 of our brand new pilot with the Alzheimer's Society called the Dementia Innovators Programme. Now, they are all around supporting innovators to develop fantastic ideas around healthcare, okay? And what we do is we recruit you onto our programme and you get access to a year's worth of support, learning, mentorship, and opportunities. That is what the programme is in a nutshell. So, as you know, applications are open now. They close on the 29th of October. There is a review and panel process between November and December. Successful applicants will be notified early January, and all 3 programmes will start right at the start of March, and you will have 12 months access to our program, and you can go on and become alumni afterwards if you want to. So what does the program entail? So the core learnings are our pit stop events. So they cover everything from developing an intrapreneurial or entrepreneurial idea. So that could be forming a project or maybe a startup. We do everything from business planning, lean canvas, through to developing teams and leadership, communications, and also around funding, all of that. So you've got all of that information on the website. You can actually see all of the modules that we cover. Every program has access to all of this. Around these key pit stops, which you can attend either in person or online, so we try and make it as flexible as possible. You also will have opportunities to attend webinars, workshops. We do hackathons. We did a fantastic hackathon this year with Air Innovate in Leeds, and it helped. Oh, sorry, I'm just admitting somebody. Helped to develop platforms with some of our clinical entrepreneurs so they could see the scope of their ideas firsthand. So that was fantastic. We've worked with IBM. So recently we had an IBM day, and we've actually got a YouTube Health Day coming up. So as entrepreneurs on any of these programs that we're offering out, you will have access to these fantastic opportunities. On top of that, you will also have access to a fantastic network of fellow entrepreneurs. So Tamsin is one of them, but we have over 1,300 entrepreneurs that have gone through the program in the past 8 years. They are incredibly supportive. There's actually a lot of entrepreneurs that work together, so you can actually connect with them. You can learn from them. They will share their stories, their mistakes, their successes. And also, we have a number of program partners. So I've mentioned a few already, but we also have connections into some NHS sites as well. So that is for the program. as I said, applications are open, but I would really like to hear from you guys tonight what questions you've got. I've had a range of questions coming in over the past week, so I'm more than willing to go through those. But do we have anybody who would like to start, or any questions from the off? Just please feel free to pop in the chat, or just introduce yourself if you'd like. You're more than welcome to introduce yourself in the chat. If not, I will go to some of the questions I've been. Hiya.
Hello. Hi.
Hi.
Hi. I've got a question about
Yes.
the idea. What if it's something that as far as you know, hasn't been done, but what if it's in the offing and you just don't know about it? So you've got this idea and you think, it's a great idea, but actually you guys read it and you go, oh, well, we have actually one of our entrepreneurs is actually doing something really similar, and so we're not interested. Is that true, or is it more that you go in for the person and the concept behind it?
So I'll get Tamsin to come in on this a little bit as well. But what we do ask in the application is, what research have you done around that idea? Okay, so we would expect you to do a little bit of a desktop search, kind of understand what maybe is available on the market. If there is something similar, that's fine, but why is your idea different, or how are you putting a different slant on it? We get, I think, Tamsin, you can come in on this, but we get plenty of people who maybe are developing apps, but maybe there's just a slight difference there, or uniqueness to that. Just because it's already being done in a certain way elsewhere does not mean you will not get on the program. We look at, so there's 5 criteria, which we make quite plain on the website, that an application is scored on. So it's motivation, personal capability, impact to the NHS. I haven't written them all down, but there's 2 others as well. I'll share in the chat. I will share in the chat. So, you know, it's not just that innovation, it is that person. It is looking at what the priorities are for the NHS as well.
Okay,
does
great.
that help?
Yes, you know, and you have a bit of you sort of start doubting yourself. You think, oh, what if,
Yeah.
and actually I just know I'll just go for it, and if it isn't right, it isn't right. But thank you.
Tamsin, do you want to jump in? Go on.
Well, I was good, and well done. You, by the way, we would absolutely love it if you put your cameras on. I know it's really difficult when you first go to things, you don't know if you're supposed to have your cameras on or off or whatever. But this is like, it's one of those places where we kind of love seeing you, and it's completely fine, and we try to be relaxed, and there's none of the, oh, look at you all, thanks. And then we try and you know, we don't have the same hierarchy as you might. Some people sort of feel in a hospital we are all innovators, we're all together in the same thing. So it's really nice to see you all. That's so cool. And feel free to like introduce yourself in the chat, because you're starting the network already, you know. You can be entrepreneurial. But it's such a great question, and thank you so much for like opening up with that, because I think that, so look, you can't know about everything, but it doesn't go down well when the panel who are looking at your assessment Google it, and then there's loads of other things that are in that space, and it doesn't matter at all if you are in that space. They just want you to know about it. So because other people say, oh, there's other people in that space. When Apple started as a computer, they were up against, was it 30, Lucy? There was like 30 other computers. So like Apple came in and just did it better. So, you know, we're perfectly, there are several entrepreneurs who are in a similar space, and sometimes it ends up that they kind of eye each other up and find their unique identifier. And so the bit that makes them particularly effective in one particular area. And sometimes they eye each other up and go, do you know what, if we partnered, it would be pretty good. And that has worked really well. So there's been plenty of partnerships that have ended up developing. And Lucy's already touched on this, but so just, it's a benefit to know. You look better if you know your competitors. It's not a downside. And there is, you know, part of it is about innovation, but this is a workforce development program. So it's about empowering and developing the workforce. So people in the NHS, it's about developing you. And the really interesting thing is that even if, because some people will start their innovation and realize like they actually, you know, are they going to go and raise money or keep going at this for however long they, once they've worked it out. So sometimes they pivot. But what we've also realized that people who don't necessarily take off with their innovation end up in the most extraordinary roles and end up in leadership roles and end up slightly changing the culture of the NHS. So you as a person being an NHS clinical entrepreneur, and that's partly why there's lots of questions about what you've managed to change and who you are and getting used to do a 1-minute pitch, because that is also part of what people are looking for. So yeah, lovely questions to start with. Thanks.
Thank you.
Got a couple of hands up. So was it Georgia who's first? I think it was. Hello.
Hello, I'm Georgia. Sorry, I didn't really introduce myself in the chat. I'm a student nurse, but I'm also thinking of applying to the patient entrepreneurship initiative program. Sorry, my caffeine's just worn off, so I apologize. So my question really is my idea, my innovation is more of an initiative. So a lot of the things that I've seen on the CEP and PEP website, that they tend to be products, or from what I've, from the bits that I've seen, like an app or a questionnaire or like a specific use thing. Whereas mine is more of a sort of more of a service. So I'm happy to sort of talk a bit more about that, but is it sort of open to these initiative type things rather than a single product?
Yeah, thank you so much for bringing that up, and you're welcome to expand on it if you want to. But but yes, I think that sometimes it looks like the people that are holding a thing are at the front, but it doesn't have to be a thing. And also, as Lucy said, people call it kind of, you can be entrepreneurial and have a product or a thing or a software or whatever you want that you want to spread across the NHS or maybe beyond the UK. And you would be kind of like seen as being entrepreneurial. But then there's a lot of people on the programme who are intrapreneurial, who are sometimes just wanting to change a system or a process or a service. And actually the service, of course, can be entrepreneurial and entrepreneurial. But so both are represented probably reasonably evenly, would you say, Lucy? Yeah, we have a lot of digital health solutions, don't we? And some of them that have been the most effective have been something incredibly simple. So, for example, I was thinking about lovely Deb, who is a GP, who had just had an initiative which was to ask all the carers that went into their homes, when they went in to do the piece of care that they needed to do, or the feeding someone, was to say, can you show me your meds, please? And it was called Show Me Your Meds. And it was from that, she got the carers to report back about what was happening with the meds. Was the one for the correct day being taken? Did they understand what was going on? And from that, it fed back to the GPs, and they worked out that they could save the NHS loads. It was good for the carbon reduction plan. They actually diagnosed more people with dementia who were forgetting. And it was like the most useful thing. She ended up in a leadership position in the Geriatric Society. It was beautiful, absolutely beautiful. And it wasn't something actually that was particularly making money, but it was fantastic for patient care. And she's done beautifully. And also, Deb, oh my goodness, she gave the most amazing pitch the other day in Newcastle. London, wasn't it, Lucy? She did the most beautiful pitch, and she swore at the beginning, I'm never going to stand up and pitch. She did the most beautiful pitch, and then she pitched to like about 700 people in front of the Geriatric Society. So, come and be more of you,
That's great. Thank you so much.
And well done for putting your name in the chat straight away. That was lovely. Lucy, did you have a hold on who was next?
No, I didn't. Who's next? Somebody just speak.
Sorry, was it Spencer?
I think it was.
Can I?
Yes, of course. Hi.
Yeah, sure. Hi.
How do you say your name?
Shweta.
Shweta.
Is that why you didn't call it out?
Well, yes, maybe. Well, actually, I'm slightly.
I was thinking the hesitation might be because of pronunciation, but here we go. So Shweta, I'm a breast and plastic surgeon, Bath South. So apologies if this has been partly answered in the first few questions, but so my specific question is about multiple ideas and how to put them in the application, because I have an idea for a device for which I have received funding to develop. But and of course I'm putting that as the main idea. So but as soon as when I started filling the application, there's a drop-down menu and I said medical device. But then I find that the subsequent questions are a bit restrictive in the sense that then the questions are just geared a bit towards, okay, what's the name of your device? Have you tested it? And things like that. While that is one of the reasons why I want to join the program. But then there are a lot of other ideas which are likely to have a bigger impact than the device, which I want to A, put across in the application, B, have the skills to develop from the program or take it to the trainees and colleagues and share it with them. So that's the main reason, but I'm finding it a little bit tricky to put all that down in my application because the device seems to be taking up the limelight.
Yeah, actually, Lucy, do you want to, shall I go first? Do you want to come in? Yes, you're right. You are not the only entrepreneur that has several ideas. Lots of people have many ideas, and lots of people are very entrepreneurial like that. So, and often people have tried out lots of different ideas before they settle on one. It does work well, best maybe for the application form. I'll defer as well to Lucy, and she can speak in a minute. But I think it works best to stick to one idea. It is absolutely normal for people. Well, because it's the best way to showcase yourself, choose your best idea and choose you, because there's only so much you can do with an application form without it being like multiple pages. And obviously it's perfect to have people with lots of ideas, and we have serial entrepreneurs, of course. When people come onto the program, they worry about, like, I started with this idea, but actually I might switch to this other idea. Of course, that's totally fine. You might learn on the program the best one to switch to. That's fine. You might pivot. So you might like start aiming for one group of patients, and you might pivot and realize that it's better for another group of patients. So you have a lot of freedom. You should have a lot of freedom on the program. It's kind of light touch in many ways. So it allows you to take what you need out of it. But it might be best to showcase your best idea on the form and when you're talking about yourself, and then somewhere mention, I've got multiple ideas. That's not a foreign concept. And actually it's been amazing because the program's now running for its 9th year. Just now we're seeing people who've been multiply successful. I mean, oh my goodness, as if having an NHS job and having a life and trying to do something isn't innovative on top of it isn't enough, but to kind of like then do it again is extraordinary. Yeah. And we have people in that space, so you should meet them, because it would be lovely for you to meet people who have the same kind of brain as yours, and that's one of the benefit of the network, is that other people will kind of help you navigate those things. Lucy, what do you reckon?
You covered everything there, really. We would always recommend you just go with one idea. You have such limited space there. Showcase one idea brilliantly, and then if you get on the program and you pivot, brilliant, or fantastic. But for the sake of the application, stick to one, make it fantastic, and focus on that one that you have the most in-depth knowledge. You think there's a real problem there, and you have got a great solution for it. So yeah, I think Tamsin covered that all there.
Emily, did you? No, that's so lovely. I'm glad that we're on the same page for that. Emily, did you put something in the chat? Did you?
Yeah, so one of our serial entrepreneurs is Alistair Darwood. He is absolutely awesome, and I say definitely check out what he's done. So I've put a link to the case study we created.
So Emily will. So one of the multiple things that happens on the program is that we try to do case studies of you, if you would like that to happen. So we would showcase you, and then you can share it. But also it means that if someone comes to the Clinical Entrepreneur Program, as they sometimes do, and say, we're looking for innovations in this particular area, we can kind of really quickly find them and then send them on to people, so that you kind of get the most of those opportunities. So Emily gathers all of those case studies. So there isn't anyone that Emily doesn't know. So it's great. And actually, there's quite a few, aren't there, Emily, who because Tim Allardyce as well, isn't he on his second now? Yeah, perfect. Does that answer your
Yes,
question?
yeah, absolutely. Yeah. Thank you. No, that was very clear. Thank you.
And exciting that you've got multiple ideas. That's great. Was it Ruth? Sorry, I don't know if I'm getting that right. Was it Ruth with next? Is that right? Does that feel right, Ruth?
I think we've got two Ruths, but I think it might be
Oh,
Ruth
sorry.
Hall next. I'm not.
It's Ruth Hall next.
Is it Ruth Hall? Okay, thank you. Hi, Ruth.
Are you struggling? Yes. Will, are you in your mobile office? I'm very familiar with that sort of office scenario. Yes. Do you want a moment? Do you need a moment, or can you unmute?
Hi. Yeah. Sorry about that.
No, it's fine.
Yeah, in my mobile office, as you would call it. I just wanted to. So I'm applying for the programme, and my idea is more of a service-based idea, and I've had conversations with my head of service and innovation lead, and nobody from our trust has actually applied for this before, so it's relatively new ground for them. So I'll probably be the guinea pig in it if I don't get on in terms of the success, the outcome of the success of the outcome, or whatever you would say with that. Anyway, the question I want to ask is, I think the innovation team with my idea are quite interested in supporting me in an entrepreneurial way / entrepreneurial way, and that is making me question, what is the benefit of applying A as an entrepreneur or B as an entrepreneur, and can you apply for one route and almost cross over to the other side if it felt more appropriate throughout the programme? And if you can't do that, what do you suggest is the best route? Because my trust are quite flexible, I think. They would be happy for me to apply entrepreneurially. So I'm quite lucky, I guess. That could be a little bit of ignorance on their side in terms of what I'm signing up to.
What's your NHS role?
I work within the performance information services within our trust. So my role is very much about data insights, gathering data, sharing insights. So that's my role. So I can see why the idea that I have, I can see why it would fit in as a service within our trust. And I think the view would be, if it did become some sort of entrepreneurial outcome, it would also support the trust and perhaps work with other regions, other trusts within our region, if we thought of it at a regional level, which I think is a really good opportunity, but they're not fully committed to that. They're still in the early processes of understanding where my head's at and what the idea fully is, which is kind of what I'm applying to the programme for, to get those skills and get that across really on paper.
I think that sounds completely right. When I applied, it was probably similar. I think I just hadn't really thought past trying to get it out into my own hospital. I mean, that just seems like such a massive task, doesn't it, to just do that? And then and we don't have the skills, so unless you join the program, you don't know what skills you don't know what you don't know, do you?
Exactly.
So it sounds like it could be both or either or whatever you need it to be, doesn't it? And data is so important at the moment, and we have lots of people who are around, in that sphere or on that kind of platform, and so there'll be plenty of people for you to meet and understand more from. I think it sounds like it would be worth you trying, but you're thinking that were you feeling like you might want, if you started and it might not work out? Was that part of your question, or was I getting that wrong?
I guess I think initially I just assumed that I would go down the entrepreneurial route, but possibly didn't have a good understanding of what the entrepreneurial route meant.
Actually, I'd say don't worry too much about that. It was just really, I think it's a way of saying we appreciate that some people have got valuable innovations that are worthwhile to services, which are smaller in nature, or affecting a service. And actually, partly, I mean, I think that once I joined the program and watched what other people were doing and thought about what was possible, then you can start thinking a bit bigger. But sometimes you don't know enough when you're first starting, so don't worry too much about that. It's just that both are accepted and both are valued.
Right, okay, got you. And is there a massive difference between the two cohorts? Is everything sort of done separately between the intra and the contra?
No, it's all
the now called.
It's at the moment, it is kept, everyone is kept together. And
right.
And whilst of course there is different learning at different stages, the program has been designed completely amazingly by the team, actually, to make sure that it kind of addresses all of those skills as you go along, because people need to know all of it. Because some of it's around funding, which everybody needs to know. Some of it's around what you should do with your social media account, how you're going to brand yourself or your business, or how you're going to put it across, or how you're going to pitch your idea, or what industry. Did you know that there are industry partners out there that might be able to help with, you know? So all of it is done in a kind of chronological way so that you get further understanding. And what we find is that if you kind of put it in front of people, then people kind of think, okay, yes, I could do that for this. Or, you know, maybe not that direction, but you need to tell people the directions they could potentially go in before they choose one, right? So yeah, so don't worry, I think you're in the right space, and we have similar people on the program. And if it's not, you know, entirely apparent, that's fine. It should, you know, we don't expect you to have all of the skills. We expect you to be thoughtful and understand it, to have researched, to have understood the problem, and to have a good idea moving forward. And exciting that you're the first person potentially on the clinical entrepreneur program in your team. That's great.
I know. Well, in the trust apparently, which I was quite surprised about. So hopefully the first of many.
Great. Well done. That would be a good thing, wouldn't it?
Well, that was good reassuring advice. So thank you very much for that.
No, lovely. Thanks for joining on the mobile office.
I'll try and go on to mute now.
Sorry, was it Ruth Eakin? Is that right?
Yeah, that's right. Thank you. Thanks very much. So I'm coming from a slight. My questions are what I have quite a large kind of social enterprise project that I really want to get going, but it's not within my clinical job. It's totally outside my clinical job, but it's really good for healthcare in general. And it fits with all the sort of various strategies that are coming out of government. My problem is the space, the place, the physical place that we want to get going. We just can't get access to at the moment. So it's a matter of discussions between another type of social enterprise, which is very supportive, the trust, the Department of Health, and various things like we've been trying to negotiate for the last 6 to 8 months at the moment, trying to work our way through to get a green light that we can then use the space to start up the social enterprise. So my question is if I were to apply and to succeed, I feel a bit, well, I don't actually have the green light to get going with the actual innovation just yet. So would it be something that could be useful to me to help continue to try to get the green light to get going? Or should I wait to cohort 10 and hopefully get the green light, because nothing happens quickly in public service decisions?
No, it doesn't, does it? But it sounds really exciting about what you're doing. And it sounds like you've got a lot of passion and you're really trying to get to the bottom of it. And actually something that really becomes important, I mean, Lucy and Emily will tell you this, it's all about falling in love with the problem. If you fall in love with your solution and then it doesn't work, or it doesn't thing, or people trying to elbow a solution into a different problem, you know, that's where it starts to unravel a bit. Falling in love with the problem is the biggest thing. If you think that you would benefit from joining in the next cohort, then great, you know, join on the next cohort. But also, like, maybe throw it into the ring and come and join the conversation. We don't expect, like, it's a horrible journey, entrepreneurship, on the one hand. I mean, it's exciting and it's brilliant and you're at the coalface. But the other side is all of these type of barriers. And so, and actually the barriers can burn you out if you're not careful as well. So part of it is that, like, meeting other innovators where it just doesn't feel like it's such a big barrier. Sometimes you're like, actually, I'm all right, I'm doing okay. So you can't have everything right all the time, and it's difficult. And so that's entirely familiar. So I think that you could feel reassured by being able to say, this is a current barrier and we're trying to fix it by doing X, Y, and Z, or contacting, as you said. You know, you sound like you've got to grips with something that could be a wide problem, and you know, that would make you a great asset to the rest of the cohort, not even just that maybe you could learn from other people, you know. So maybe it's worth throwing a hat in the ring. Annoyingly, I don't get to decide who comes on. So do you know that the applications go through at least sort of a panel of people? So at least 3 people who independently, they don't know what the other people have said. So yeah, sorry.
So I think it's no, thank you very much. That's really encouraging. I think it sounds, I mean, I really want to go for this. I'm really enthusiastic about it. And I think if it's okay for it to help me to get to the start line, then I'm good with that. I just didn't want to sort of go all out and then arrive and go, well, actually, I can't actually start my project yet, or I might not even get to the start line. I don't know. But, you know, some days I feel, yes, we're definitely going to get there. Because there's no, you know, I look at it like a long road, but I don't see any roadblocks. There's no actual blocks at the moment, but I know where those blocks might come. And we're putting in as much as we can to try and mitigate or stop those blocks should they arrive. But I mean, you know, we've got all the patience in the world. It's just such an amazing thing if we could do it. All the pieces are there, it's ready to go. We just need the green light. So there's two challenges, and I think I'll probably be pretty knackered if we can get the green light, and then I'll hand it over to somebody else. No, I won't, I'm only joking. There's a group of us who would then be ready to take it on, but the big issue is actually just getting to the starting block. And if we could get to the starting block, I'd be absolutely thrilled to bits. And especially if I could get to the starting block and start the program at the same time, that would be just amazing.
Ruth, I'm going to just, add something there. We don't expect you to have everything lined up and completely in order for the application. So I would say apply. I think the connections and the network that you will make will probably help you along that journey, either just through, you know, peer support and experience. I mean, we do have quite a few social enterprises on the program as well. So I would apply. In short, that, you know, you shouldn't have to worry about having everything perfectly in order to apply. So there you go.
My worry is that I apply and we do actually come across a block that says, no, this is not going to happen. And I'll just be completely gutted. I think and hope that will not happen. But I just want to do everything I can to actually get it over the line. So thank you. Thank you.
Yeah.
Thanks for that.
Thanks, Ruth. That's lovely. Thanks, Lucy. Oh, sorry, I really can't remember who's next. Was it Chantal? Was it you, Chantal? Oh, is that right? Sorry. Can I go for Chantal?
I really don't know if I'm next, but yeah, I'll be glad to ask the question if I will be given the chance now. Is that okay?
That would be lovely. Introduce yourself and say what.
Yeah, so my name is Chantal. I'm the anemia nurse specialist of the Marsden Hospital. And I've been wanting to join the program like 1 year, 2 years ago, but it just really didn't materialize because of so much work. And now I just decided to try again, ask some questions, because in a way it has progressed, my idea. It has been so there's like an integration of a new system. I'm not sure if others are familiar with it. It's called EPIC. It's now it's an American-based software that's being used in the NHS and currently used by most or a lot of hospitals now. So my idea is about automated triage, which is now happening in my unit as an anemia nurse. And I know it has so much potential and it could be enhanced farther and could be of service. It's scalable. It could be huge undertaking. It could have as I've said, it has a lot of potential, not only to the service, but could be in the other hospital service as well, because it's scalable. The idea is to develop that, but I'm not sure if how will I approach doing it. Is there someone, like, do I need to approach a programmer to do it, or can I get someone to help me when I'm already there, because I'm not digital? And that's my other question. I am currently applying for mastering in digital technology innovations. Would I be able to still progress with my application just in case I'll be accepted there?
Yes, so people, we don't restrict anyone going on accelerators or different programs. That's absolutely wonderful. Sounds incredible what you're doing. There, it's not spoon-fed enough that you would say, I need someone technical, and we'd go, here you are, ta-da. It's because, but there would be a network of people, and there would be industry partners, and we could direct you to mentors who would be able to give you choice on that, and you could maybe then work out what your next steps would be. So you don't have to have it fully formed. People can work that out on the program. We have multiple people who are experts in this area. So and actually, as Lucy mentioned, that we've had previous hackathons and things where occasionally industry partners have just taken on one of the good ideas, maybe more than one, and just developed it. So I think that you're okay. I think that you would still have to put in that work to make the right decision for you. That's really important, that actually nobody else makes that decision, because whoever you work with has to have the same value set as you and be aiming towards the same thing as you. So you don't want anyone else to be making that decision for you anyway. But you would be eligible to apply, and it's amazing that there you are doing your amazing work, and you have worked out a triage system which works within your hospital. So
yeah,
that's cool.
I have tested it, and now they want to expand my unit, and I can see that it could be applied to other services as well. So and then I got because I presented that I can't patent it. I have to spend a lot of money to patent it, so to protect my rights, and to see just to say that I initiated it. I presented it in the European conference for the patient blood management group, and it has a good following. So
Good.
I was actually invited to speak about it in the Southwest
Well, well
region.
done. That's
which
really
is
good.
well
Good.
done for me,
Yes.
but it's just very raw. I can say.
But that's okay. Yes, I understand, and that's also a barrier that we frequently encounter. So we have a particular thing about protecting your innovation. We have a particular pit stop and education and networking events. We can put you in touch. There are certain webinars that we host that have lawyers on them who help people within this area. So that is something that can be addressed. You're not alone. Other people have been in this position a lot. So that would be
really great.
there's a lot to learn, and it's none of this stuff is taught when you're doing your initial NHS training.
Definitely.
Thank you, Chantal.
Okay, thank you so much.
Well done for getting to that point and presenting it. Sounds
thank
amazing.
You.
Well done.
Thank you.
Sheikh, sorry, I think it was you next. I think you might have been waiting a while. Thanks.
No, it's okay. Absolutely no problem. So hi guys, I'm Mateen. I'm one of the GP partners and GP trainers in the Northeast of a successful GP in Teesside. So just a couple of questions. They might have been answered in the first 5 minutes. My internet's a little bit slow, so I apologize for that. So 2 questions. You mentioned the opportunity to network and connect with previous successful candidates. Could you provide any details on how we can have these connections, or is there a process to facilitate those? And number 2, is there a limit on the number of candidates that will be selected on the program? Additionally, do you see any significant number of applicants from primary care? Because I genuinely feel primary care is currently lagging behind in innovation. I'm just curious about the interest from this sector.
Wonderful, thank you. We love having primary care represented. We have many GPs actually, although it feels sparse, doesn't it, out in the world. But they are all on the same program, which is really helpful, and they are amazing. They are truly amazing what they're doing, and so it's wonderful when they get together, because they kind of, and we also have mentors which just love people who are up for change in primary care. So there's an awful lot that's available really for that. The network, yes, the network, there's something really special about the network, like genuinely, because I think everyone feels quite lonely, and then they get to the network and then they feel like they've finally found some people who are kind of like-minded and in the same space and understand the difficulties and what you're trying to achieve. I think that we've barely ever, have we, Lucy or Emily, had anyone who's turned down somewhere. So you can almost reach out to anyone and say, hi, I'm an NHS clinical entrepreneur, I noticed you were, and you can almost do it yourself, but also the team will facilitate those introductions if need be. Sorry, Lucy.
Yeah, I'm just going to jump in. So we actually have an intranet. So we have a community hub. You can connect with everybody on the program via that. Obviously, you have full control over your privacy. If you don't want to be connected, you can switch that off. But there is a private community hub for you to use. You will find at pit stops that not only your year will be in attendance, but also some of our alumni. So they come along, they'll either just be catching up maybe on a pit stop they missed from the year before, or they actually are really interested, maybe a new speaker, or they're actually speaking themselves to talk about their experiences so far. So there is plenty of opportunity for you to connect with other people on the program. We also do, right at the start of the year, which actually launches the year, our big pitch event. So that is a cross-program sort of celebration event, but we invite our clinical entrepreneurs to come along, attend, speak, pitch. And last year we also had stands. So there is plenty of opportunity to meet your peers on the program. I hope that's of help.
And last time that big pitch event that Lucy's talking about, there were 750 people at the big pitch event. Is there anyone you could possibly want to meet? But it's a kind of it's got a really lovely kind of culture about it, where people can reach out. And actually that Lucy's talking about there, that community hub, is just a thing of beauty that the team have put together. It is, and you can create your own forums. You can, there's quite a lot that's possible within that. You can post in there, you can connect with people, as Lucy says. It's how you match with your mentor, so that you can check the skills that you need at that moment are the right skills that you need from a mentor. And yeah, so there's lots of possibilities. Yeah. And
it's got inbuilt messaging, so you know it's like our version of LinkedIn basically. So you can connect with anybody and ask them those questions.
It's a private community.
Yeah.
Well done, Ellen. Sorry, I just saw a part of that. Were you feeding the kids? I was very impressed. Oh, letters of support. I actually, shall I come to? Sorry, I won't read and do things at the same time. Shall I come to the people who've got their hands up? Shall I go for Hayley Johnson? Hi.
Hi, thank you so much. I'm a junior doctor based in Bristol area. I have an idea. It's kind of like related to helping improve women's health. And I'm not quite sure kind of which route to go down initially in terms of like platform versus app, but I might be able to get MVP kind of before the end of the application date, but I'm not quite sure about it. Essentially, my questions are more related to the application questions, which I actually have just seen that somebody's also asked in the chat. Regards to like evidence, like using kind of an evidence base for your problem market research. I have like lots of figures. I know the problem really well, but I don't know how to reference it without kind of taking up too much space trying to evidence everything. But like, or do I just use the figures and hope that you'll take my word for it, or does it need to kind of all be like officially referenced? And the second question is just related to, I did, as part of the market research, I found that in the US there is a potential company that are doing the same thing as what I want to do, but I can't really speak to them about it because they wanted me to sign an NDA when I tried to speak to them about it. So that kind of didn't really go anywhere. And how would I go about kind of explaining that there might be something, but I don't know. Obviously, I can't access any of their actual kind of app or data yet.
Yeah, I think that yes, it is really hard, isn't it, to do it within the space that you're given. And I think that if you reference and then put your put who you're referencing, if it's not too big, then that is probably enough. We're not expecting you to do that thing where you do a whole kind of research plan and write a reference list. So yeah, it's always hard, isn't it? It's always hard getting it into the word count. I think that it's probably all about impact and putting the figures that make the biggest sense, and probably coming across well in your 1 minute pitch as well, which kind of helps to elbow a few things in. It is only 1 minute though, again. But and don't worry, I think if you've tried, that's all you can do at this point. Like, we're not expecting everyone to be completely polished or even have their MVP up and running. But if you've got a very ugly MVP, it's wonderful, you know, and however ugly it looks, you know, if it's something that's starting, then great, you know. But I think it sounds like you've got a lot of knowledge in your head, and I understand that, actually. I think I felt like that because when I joined the program, I had a device and then also an app, and I just felt like I couldn't, and they did work together, but I just felt like I couldn't explain it all. And I think one of the things that I learned actually while I was on the program was to start to get really succinct about it and get people excited about what I was doing. Lucy or Emily, did you have anything to add?
So there's a couple of things about the references. I would pick maybe one or two that are core to the problem that you're trying to solve. So such and such report states that maternal deaths are higher, you know, that you don't need to, you've got 200 words, use them wisely, pick impactful, really, really necessary references that are core to the problem you're trying to solve. Okay. If you don't know about something because there's an NDA, you don't know about it, but you can say there's something happening over there and you're aware that this is a potential competitor, etc., etc. I don't expect you to know all the ins and outs. That's fine. With the pitch, we want to get interested in this idea. We want to understand what it is. We want to hear about how it's interesting and how you're going to change something. So that's your pitch. We don't need to go into all of the figures. Okay, so does that help?
Yeah, no, thank you.
Sorry,
so
that
much.
was really short and sweet. That.
And also, Hayley, there are the most amazing women and men actually in the femtech space. You're gonna love them. They are incredible. I just like, we have sometimes, oh, I could have a t-shirt with all of their names written on because they're just doing the most amazing things. I mean, there's, oh gosh, I want to tell you about all of them. There's one physio who managed to get a following. She started doing a few bits on TikTok and she got a following of like 2 million on some of her, one physio on her TikTok post talking about something really difficult and unpopular. I mean, extraordinary. And then of course the television wanted her and stuff. She's amazing. Anyway, maybe you need to be there in the fold.
No, thank you so much. It's always
brilliant.
so exciting. I'm following all of them on social, so.
Oh, brilliant. Aren't they amazing? They're amazing, aren't they? Perfect. Is it, I can't, I might pronounce it wrong, sorry, but is it Anna? And ANH. I think it's me, and Nguyen. If not, shall we go first to, is it Georgia? Did you have your hand? Yeah.
Hiya, yeah, sorry, I know I've already asked a question.
Oh no, perfect.
Bad, but I thought of it after I'd said I didn't have anything else to add. So my oh my gosh, the words, my innovation or my thoughts are around a piece of developing a program to train experts by experience with a particular mental health condition which receives a lot of stigma, and there are lots of long-term consequences, etc. But training them to develop and facilitate specialist training to NHS staff, but the ones that wouldn't usually get access to this specific type of training, you know, primary care or people that don't work in mental health, but would come across people who have this diagnosis. So it said on the website that if you have somewhat, like if you have a support from another organization in this, that you wouldn't be eligible to apply. I don't think what I've got is really in that category, but I wanted to check. So one of the clinical educators in the medical education team for the university linked to my trust has expressed interest in developing, facilitating me developing this piece of training. It's like a 2-day piece of training into the medical education syllabus for the psychiatry attachment. That wouldn't, so that's just the piece of training. That's not the program that I'm wanting to set up, if that makes sense. The program is the training of the trainers, etc. But would that be classed as having support from another?
No, Georgie, with the patient program, that's completely fine. So it's more, have you got a partnership elsewhere and you're actually, I don't know, you've developed an innovation and they're working on it as well, but not in that not that kind of relationship. So that's completely fine. It was more for the patient program, it's more if they're more advanced and actually they don't really need support from us because they're that far advanced, they've already got partners on board, it's fully fledged, it's out there, and actually you probably wouldn't need us. So, but I think from your point of view, I think yes, you're completely fine. Yeah. Is that all good?
Yeah, that's perfect. Thank you so much.
Excellent. So we still have a hand up, but I don't think
it's probably my appalling pronunciation. It's just put everybody off. But oh, good. Hi, Ellen. Ellen, brilliant. Were you feeding children? Was it you? Well done. I'm a mum too. We love a mum entrepreneur. Brilliant.
Sorry, and we have to go to piano shortly as well. So I wanted to get my question in there.
Yeah, quick. Yes, totally understand.
Yeah, I said it was boring and then thought it probably isn't that boring. Do you want me to say something about it?
Well, tell us who you are and what you do.
Yeah, so I'm Ellen Storm. I'm a senior clinical fellow in paediatrics and neonates in Bangor Hospital in North Wales. So we're right out by Snowdon. We've got like the view of Snowdonian Mountains out the back of our hospital over the helipad, which brings in all the people who fall down the mountains. But my idea really doesn't actually have all that much to do with my job. So I'm having to explain it to my colleagues while I'm asking them whether they would write me a letter because they don't know anything about it. So I set up my business, which is called U-Turn Health, in February 2023, and it's really based around my own experience, partly as a patient and within the vegan and plant-based communities as well. So I am looking at developing a program and possibly an app using the low-fat, high-raw plant-based diet as a therapeutic modality for reducing cardiovascular risk. And it will possibly eventually have some overlap with the work I do in childhood obesity in my job. I'm kind of just starting a quality improvement project on that. So it does have implications, but it needs to go for adults first because it's quite experimental and would be a bit controversial if I tried to bring it into the children and family space at this point in time. So because it is quite new and it is quite controversial and obviously will require consent and maybe some research doing as well, it's quite tricky for me to actually talk to my colleagues about it, and they get a bit freaked out and aren't like, what on earth are you talking about? So yeah, it's
don't worry.
I'm not sure because I think it has massive implications for the NHS if I can make my argument. I've just published a book in July, which was my kind of journey. It's part autobiography, part nutritional science. So I published that, and that will has a lot of the references in it and the kind of argument that I'm trying to make. But I need to translate that really into something that's a little bit more user friendly. So I think that's really what I'm looking to do. Anyway, so that's me. But the question was really about who am I asking and why? So because I have some peers that, you know, my colleagues that I've spoken to about what I'm doing who are like really interested and really excited and stuff. But my actual supervisors and line managers are a different kind of kettle of fish, really. So, yeah.
Well, and you obviously, you must know it well, and to have written a book about it.
Them. Sorry, go on.
Yeah, well, no, it's something that you must feel really strongly about as well. To have written a book and be on this journey and start.
I made a mug. I got mugs as well.
Mug. I mean, you've committed. Yeah. So So it's amazing and well done. And actually, the thing is,
No, go on. It's all right. I was going to put my website in the chat.
Yeah, put your website in the chat.
Talking.
Entrepreneurial action. Exactly. Get everyone on it, and the book. The thing is that actually people feel like that about an innovation that they're doing within the hospital, even, you know. So I think that sometimes people are doing something interesting and everyone's like, but just see the next patient, see the next patient, see the next patient. We're all too busy. We can't think about it. Whether it's... I
did listen to your playback, Tamsin, where you said something about the ENT surgeons who do tonsillectomies being like, you know, it has implications for them. So mine has implications for cardiologists who put in stents.
Right,
and things like that. It was very similar, really. You know, if you're sort of trying to say, well, actually, you know, we can educate people in lifestyle kind of medicine and get them to cure their heart disease with diet, that's quite threatening. And I have actually had the experience of sitting in a room full of cardiologists talking about the lifestyle heart trial, which showed this in the 90s, and it still hasn't translated into clinical practice. So, you know, it needs to. It's a bit like smoking a lung cancer. You know, we are not telling our patients that atherosclerosis is a diet-related chronic disease that can be reversed. And there's quite a lot of papers now out there. There's quite a lot of evidence. I don't think anyone's really arguing about it. So it's, you know, it's more getting that into the clinical sphere and really awareness raising around it. So,
exactly.
But I did note the parallel there when I was listening to you.
Amazing. Well done on looking at the previous ones. That's very impressive.
I've listened to them all. Yeah.
Very impressive. You know, you're not the only person to do stuff outside your own specialty. We have, what do we have, Lucy, Emily? You probably know, don't you? Do we have dentists doing something completely random, or people like?
Yeah, we've got a dentist who's doing AI.
That's right.
And then, so lots of modelling around that.
Oh, I know. And there's another dentist doing something on foot ulcers. It's amazing that they actually understood it because of like the same. Yeah. So
I did come across one paper that was done about this issue in a department of orthopedic surgery. So, you know, I think it just affects so many people. For me, it was when my mum had a heart attack. That was when it all started, my interest. And I've got a public health interest as well, which is a bit broader. So I've done a bit of that. Right, I'm gonna stop talking. I don't know if you've answered the question.
Well, no. So the answer is,
who can I ask?
Do something different. And it's sometimes quite hard to ask people, but it's not just about, you know, it's more that, look, this person is genuine. We've worked with them. We know they're an NHS worker that is part of this and would get on well with the programme, and I would recommend her for this type of thing.
Okay. So if it was like one of my, because I'm on a middle grade SAS doctor at the moment, if it was one of my middle grade colleagues, would that be okay? I just wondered if it's like you need
Lucy will answer that.
Yeah, so Ellen, if it's the references, so are you applying, can I just check, are you thinking about applying for the clinical entrepreneur program or the patient one? The clinical
one. Clinical one.
Right. So references are anybody you've worked with in a professional capacity in the last 2 years. So it can be somebody on the same banding as you as well. So
because it just says letters of support. So I wondered.
That's right. Yeah.
Yeah. That's why I wondered whether that is my employers need to be supporting my application.
It is a letter which basically says, yes, I know this person in this capacity and they have worked with me under this. I
Okay,
think
so
they
it's
would
just
benefit from this workforce development program because they have whatever, an interest in innovation and, you know, whatever they
Hard to
feel like
read.
putting there.
yeah.
But it's basically a letter of support for you
Okay.
to join the program, and they can add their personal reasons why they think
Yeah.
that you would want
And
to
it
join.
it says that you are who you say you are.
Exactly.
Yeah.
And
For
how
you
they know
guys.
you.
That's
Yeah.
useful
Yeah.
to know, isn't it?
Okay.
And
Okay, super.
actually, there's a piece a little bit there, not just about that reassurance for the program and needing that, but also to let your hospital and your line managers have that conversation with you, so that you do have that, and they are aware of that you've got these ideas, and it's not just kind of something that people don't see, because it's
So at the moment I've sent them emails, I've asked them, I'm waiting for them to reply.
Yeah, well, yeah.
So
might need to chase them up on that.
yeah, no, I've spoken to them as well, so he's going to read it.
Well,
our manager's going to read it. Okay, look, lovely to pop on, but I'm going to have to go to piano. So might see you again.
Enjoy the piano.
Be nice. All right, thank you.
We've got Liz next, and I think Liz actually put a question in the chat, so sorry we haven't got to that, Liz, but do you want to ask your question?
Thanks so much. Yeah, it was a bit noisy in the kitchen, so I've just escaped into the sitting room. Thanks so much. I'm sorry for being so late on the call to come with my question. So I'm probably a little bit too early, well, for an application at this stage, but my question was sort of about commercial partnerships and things. So I'm looking at sort of devices in the sort of pre-hospital setting to try and reduce, say, medication safety incidents. And there'll be lots of different partners you could work with, whether it's ambulance or helicopter emergency medicine services. So I just want to understand, do I have to have approached a company already with sort of ideas around that, or is that sort of part of the program? Because obviously it could be commercially sensitive and it's really difficult to come. And so when you do the support, it's just from your trust then, rather than sort of commercial element of it.
You don't have to have that in place at all. People can apply with just an idea. We have lots of legal masterclasses. We have lots of legal sessions that will actually talk you through partnerships, the considerations that you should have before going into partnerships as well. So that is part of the program. You don't have to have that in place, and we're not expecting you to have your idea already being trialed with a trust or anything like that. Tamsin, did you want to add something to that? I saw you poised.
No, exactly that. I thought you'd answer it better than me, actually, Lucy, so it was wonderful. The only thing to say is that I know you feel early stage. We have it's around sort of 40% of people who are in the early stage category, and then people who are more mature, so it's really, really throughout that spectrum. And you did make it onto this CEP prep session, so I feel like I want to tell you to go for it. What's your role, by the way?
Well, so I'm like a trust pharmacist in the ambulance services. And was the sort of medicine safety lead previous, but I've got another colleague now who leads on that. But it's really about having particular devices. I know, so from the Manchester Arena inquiry, for instance, some of the devices that we're now looking at are all being developed overseas. There's nothing in the UK. And then they're going to have to look at licensing those or bringing them in through the MHRA. So there's a different lack of that sort of collaboration with partners in the UK. And we have a massive pharma industry. So why can't we be doing that ourselves?
Liz, it sounds like you understand the problem really well. And also, we have some fantastic pharmacists who are on the program. They're just so wonderful, and they speak really well, and we all need to know more about it. And so, just from the point of view of finding people who are like you, who understand a problem and have a vision about how it should look in the future, that's really exciting. It's exciting to have people who have an idea about where the NHS could be, and from that point of view, sometimes it doesn't matter if you're early stage.
Okay.
Yeah. So yeah.
Thank you. Yeah.
I'm going to give ANH, which I keep calling Anya, or oh, brilliant. And
Yeah.
I'm sorry, it's me, isn't it? Because I've said it so wrong. I'm sorry.
No,
You didn't
no,
even
you
know
said
it
it
was you.
almost perfectly.
Is it?
That's
Oh, really?
great.
You say it.
Anwin.
Anwin.
Yeah.
Okay,
That's
brilliant,
it.
brilliant. Tell us
Thank
about
you.
tell us who you are and what your question is.
Yeah, cool. Yeah, so I'm Anne. I'm a orthopedic trainee at St George's in Southwest London. So yeah, I think we're in the same hospital. Yeah, I wrote my question on there and I asked for a reply via email, but I'm back now, so I'm just going to ask it while you're here. So just two questions. One is just about the application. So when do you expect us to cite articles to back up our evidence on the application? And if so, where should we do it? Because I don't see any reference section on that form. And the second one is my project is about, I think I hope to pilot a project at a hospital in the NHS, ideally in London. If I'm accepted onto the program, and if it is an okay project, is that an option to pilot the idea? Thank you.
Wonderful, thank you. And are you on call and phoning in?
Yeah, I am. I just
you are. Well, you get 100 points for being here. That's amazing.
Thank
yeah,
you.
fantastic. Yes. Sorry, there were two parts to that, and
yeah, the reference and the,
references. Thank you. References.
Yeah.
I know you want to do the academic thing. You want to have your reference list and everything. You don't need to have that for this application.
Okay, great.
Just like maybe put it in brackets. Maybe choose your best ones, your highest impact ones. You've got a small amount of words, so just go for your highest impact. Maybe quotes or references around something, but you might have to choose out of those, and that's okay. It's more to just show that you are recognizing where your data is coming from and you've done that piece of research. It is restrictive, the form, but there are many hundreds of people who apply, so they keep it short.
Right. So if I put in numbers and figures from reports, I can just leave it without any references.
Actually, I would use those. Like I would either, as Lucy said, like I would either say from this report, like we've seen X, Y, and Z, or quote the numbers, and I would put something in brackets. But you might have to limit that. Yeah.
Okay. Yeah.
How many times you do that, which is correct. And then piloting something, we have obviously that is 100% part of people's journeys. We wouldn't say we will, like, here's your pilot, off you go. We would be able to have, you'd come to education networking events where you would understand how to start your research. You'd understand where to apply for funding. We have a sister program called the Insights program, which is a collection of innovation-friendly hospitals that test and trial as well as adopt innovations. We would introduce you to those people. We also have an academic sort of thread that goes through the program. So we are, so for example, we've got a presence at the BMJ conference. We have the BMJ editor who can give you advice about what you would need to put in a piece of research or piloting. You would also want to know, did you say it was a device? I can't remember.
No, it's a service improvement pilot.
Yeah. So sometimes for you, maybe not, but sometimes it might need some sort of regulation in there, and your pilot might have to match what the regulation is going to need later. So to prevent you from doing something and then realizing you've got to do it again. So it would be, whilst no one would hold your hand to set up the pilot, it would be, it would put you in the right direction, I guess, and also just be able to speak to other people who've started pilots. And yeah, it sounds like yes, and so I think those partnerships and networking around that, it's fairly strong in that context.
Okay, cool. Thank you.
Thanks. Is it Robert next? Hi, Robert.
Hello, sorry, can you hear me?
Yes, thank you.
Yeah,
Yeah,
so
go ahead.
I'm
Let us know who you are and what your role is, and then.
my name's Rob. I'm a neurological physio working up in Scotland. My accent might give it away, but I'm Australian. A lot of people ask me why I'm in Scotland. It's certainly not the weather, but anyway. So I'm a little bit late. So some of these questions, my question might be answered in some of the prep work. So forgive me if it has. I got funding to do a feasibility study from my local board here, which is through the Charitable Foundation. I just wanted to ask about like any suggestions about funding for the backfill to attend the program, if that kind of makes sense. Because to do my project, I had to get the funding to get my program going forward. Before that, my management were very kind of restrictive because my role is a cold-faced clinical role in sort of FCP primary care, but my heart's in neurophysio. And it was just around like, have you got any knowledge or experience of people have gotten the clinical backfill funding for it? Yeah.
Yeah, it is. Yeah, wouldn't that be lovely? And it is.
Yeah.
I know. So there are certain accelerators and programs that have previously offered that. This isn't funded to give that, and I know that would be, wouldn't it? That would be perfect. That's what people need. Is you need time. Part of being on the program, people do say about is sometimes trusts can feel proud enough of people being on the program that they start to allow people to. It has been known that people have managed to negotiate time to work on their innovation within their job plan. It is down to individual negotiation to do that. It's something that the team have, of course, been really on about, of course, backfilling it so that people can have that time and dedicated time. And it's, you know, it makes it harder, doesn't it, of course, to do it without that. But of course, the funding is what it is. So the only thing we're able to offer is it being a free program once you get on it. And actually, occasionally, Lucy, we do offer, don't we, to cover certain things. For example, we do have a pit stop in Ireland and in Scotland, actually. And so we might, if we've got funding left over, we're able to do it. We might say, look, if you want to get there, we'll try to facilitate you getting face to face. So, for example, we might say, all we can do is as many, as many hotel rooms as we can for that particular pit stop, but we haven't got funding above that. So yeah, we need people to be extra entrepreneurial and see what they can carve out for themselves. And a lot of people are doing this on top of what they're doing. Yeah, I'm sorry.
That's perfect. So I mean, as I said, I secured some funding initially to do a kind of cedar feasibility study, and they said they gave me 6 months of funding, 1.5 days a week, and then they said come back once you've kind of done the initial step. So
Rob, that you need to come and tell us how you did that. I mean, that's amazing.
It was like
congratulations for securing that.
You.
I mean, wow.
It was
that's great.
It was a Dragon's Den kind of competition, similar to what this is. I had to do a pitch, prepare an application, do a pitch to our kind of dragons, and then from that I secured some funding to kind of do the feasibility study. My original plan was a bit different, and then it kind of shaped into a feasibility study, and then dive into the world of AI and gait analysis and algorithms as a clinician. So yeah.
Amazing, and well done. You really carved out a little bit of space to develop those skills.
Thank you.
That was incredible. Yeah, come and tell us how you did it. It's amazing. But
how I did it.
when you, yes, exactly. I don't know how you did it, but
yeah, coming very close to divorce. No. Yeah.
Yes. Well, it's finding the time is very difficult, isn't it?
Yeah. No.
Yeah.
That's great. Thanks. That's my question answered. So thanks very much.
No, perfect. Emily, were there some other? Sorry, I haven't been able to follow the chat as well. Is there any people in the chat who haven't been able to raise a hand?
I think one question, which might be for Lucy actually, was when clicking other, is there a word limitation on the application form? I believe the word limitations are stated on each of the questions, so hopefully it should be there for you. But yeah, hopefully that's helpful.
Should be able to see those actually on the application form. Yeah. Most of the open ended questions, they are 200 words max. So use your words carefully.
Brilliant. Does anyone else want to open their mic or have a question? Made you all turn your cameras off now. Well done, Anthony. You're still with us. Thanks.
Just going to go through a couple of questions that actually might be useful for some people that I've had come in this week. So I don't know, it might be. So I've had a question about where do pit stops take place and do I need to take part in person? I think we've kind of covered this, but we actually make sure our pit stops take place around the UK, so they're not just in London. We have partners, as Tamsin's already said, in Belfast. We have partners in Scotland, so we do make sure that we travel around the country, so everybody has an opportunity to attend at least one in person, we hope. Just to add what to Tamsin said, we do have a really, really limited travel fund for those who are really struggling. It isn't guaranteed, you have to apply for it, but there might be a little bit of support, okay, if you're really struggling. And again, we actually offer all of the pit stops in a blended way. So they're streamed on Zoom, they're recorded so you can catch up with them on our community hub. So just to let you know, we try and make sure that everybody gets access to that content. Okay. I actually had somebody who was a little bit more advanced and they were actually asking about what benefits they would get from the program. And I think a lot of that is actually the connections that we've got, the networks, the network connections into industry as well are really valuable. International opportunities. We also have some fantastic business planning sessions that we can offer people who are a little bit further along. For those who are really early stage, some people like, oh, should I really apply? I'm really early stage. We support the really early stage people. We do lots of foundation work, we do lots of sprint sessions around lean canvas, around your business idea to really support you and get you back up to speed. So please don't feel if you're really early stage, or maybe I shouldn't apply. If you've got a great idea and a problem that you want to solve, I would give it a go. Okay. Some of the practical questions I had about the application portal is, somebody said they couldn't see their video. Just to let you know, there is a practice option there. You can practice so you can see yourself on there. You are not getting recorded at that point. You can skip it and just go straight to the question. Please make sure you save it. If you're not happy, you can rewatch it and you can re-record. So you can practice that pitch as many times as you want, but please make sure you save it and submit it. And don't leave it to the last hour on the 29th. Just a tip from last year, okay? I had somebody who wanted to upload a longer video. Sorry, that isn't allowed. We want just a minute and we want you to submit it on the portal, okay? So everybody's on the level playing field. You're not going to be able to sneak in a 6-minute video explaining lots more, I'm afraid. So sorry about that. You do need to submit all your letters of support with the application. So this week I've had a couple of people saying I might not get them in time. You need to submit it all on time, I'm afraid. If we have any applications that are not complete, unfortunately, they will not advance to the assessment phase. So please make sure you complete it all on time. If you have any questions, we're here to support you. So we will answer those and we will do our best to support you right up to that end point at 6 o'clock. What else were the questions? So for the patient program, you do not need to provide letters of support, okay? You just need to make sure you've got an updated CV loaded on there, all right? And yeah, that was some of the questions I had this week. I'm sort of collecting them so I can add them to our FAQs next year. But is it, oh, I've got a couple more hands coming up after that. Chantel, I think you were first.
Sorry. I'm just curious, are you giving the schedule ahead of time? Because if I'm still in the process of applying, but if I will be accepted in my masteral, they already give the schedule. And then I don't know if it would conflict with the current schedule of this. And Tamsin said they're not limiting people from taking other studies, but I think it will synergize in a way, because if I'm studying digital technology and solutions and my project would be about it, then I can get the theory and I could blend it with the practical and the advice of the people in this program if ever I will be accepted.
So we release the dates for our pit stop events, which are our main learning events, with the offer of the place if you get on the program. So you will have at least 6 weeks notice for the first one. The first actual event is on the 5th of March. I'll let everybody know that because that's actually our big pitch event. But subsequent pit stops will release them when you get offered a place, so you can book them in as quick as possible, because we understand that you've got lots of commitments and you need to book that time in. Does that help?
And actually,
Okay.
that is why every pit stop is offered in a hybrid manner. So you can, I mean, it's better to turn up face to face, of course, when you're doing networking. But it's, we appreciate that people have jobs and families and innovations. So we need to keep it as flexible and as easy to access as possible. So if you can't turn up face to face, you have the option to join remotely. If you can't join remotely, you have the option to watch on catch up. So you should be able to do it with everything. And we try to, there's about 9, isn't it, Lucy, pit stops throughout the year, is that right?
It'll be 8, yeah.
8. So it's kind of, we try to make it manageable enough. And then there are plenty of the other opportunities which you can access depending on whether they suit you, whether you like the look of them, whether you're free. So there's 8 of the education pit stop learning. They're called pit stops. They're education and networking events, throughout the 12 months. And of course, we appreciate that you might not make it all of them. So yes, that's why it's specifically designed so that it fits around busy NHS workers who are doing other things.
Okay, thank you so much. Thank you.
But lovely to speak to you. Ruth, what were you gonna add?
Thank you. Just a quick question about the application form itself. So if you press other, when you go down the list and go to pick something on one of the questions and a box opens up, is there a word limit on that box?
Like if you've got, have you got partners or have you worked with mentors and things like that? I think it's 50 words, Ruth, for that
50
other
words.
One. Yeah, 50 words.
And that sort of fits in with my related question was, I presume you can start at the application form and then hold draft, keep it in draft and then go back to it and stuff. So
yeah, so on the bottom there should be a save and exit. So there should be save buttons at the bottom. So just make sure you save as you go along. Okay.
And each of then when that opens, it'll be about 50 words.
For the other section, if you go, that's 50 words. For the open-ended CES question, it's 200 words for those.
So 50 or 200. Thank you very much. Thank you.
No worries, no worries. I think we had question in the chat. Bing, I don't have a specific idea. Can I still apply? You need to have an idea. That is what the application is partly around. So it's about obviously yourself, your motivation, but you have to have an idea. The questions we ask about a little bit of research, what else is on, the market and things like that. So yes, you do need to have an idea to apply. Any other questions? We've only got a couple of minutes left, but does anybody actually want to practice their pitch? We did it last time.
Sorry, I got a subsequent question from your
Okay, yeah,
answer.
sure.
And so say if I want to open a AI in healthcare consulting business sort of thing on the side way, would that classify as an idea, or that's not an idea sort of things?
Problem are you trying to solve?
So it just, well, in the day-to-day work, I find people don't actually understand what actually AI in healthcare is about in the NHS, especially the decision makers, and then subsequently the decision maker making the wrong decision because they don't have that knowledge.
Okay, so are you looking more about training and understanding? Then is that maybe your idea? Is that the, so what I'm trying to get at is, you say an AI consultancy, but really think about the problem that you see every day. So if it's people not understanding what AI is in your job in the NHS, focus on that problem and think about what you need to overcome that problem and what that solution would be. So that's what you need to come in with your idea on. Basically, focus on a problem. That's the first, that I think that is the main thing we say to applicants. Don't just go, I want to create an app, because that's just that might be a personal project or anything. You need to focus on a problem. It has to be relevant to the NHS. We ask what impact it's going to have on the NHS. Does it link to the long-term plan? You know, why would it be significant to the NHS? So really think about these things. There is a lovely guide that Emily actually did alongside the application questions that goes through question by question, and it gives you some top tips. Have a look at that, but go away and really think about your idea and the problem you're trying to solve. There is a really great recording that we do around Lean Canvas as well. Have a look at that if you haven't already been, because I think that will be really useful for you. Is that of help?
Yeah, thank
Tamsin,
you,
have you got
Lucy.
anything to add to that?
No, Lucy, I couldn't possibly improve on that. That was perfect.
Sorry, Bing, I hope you didn't think that was harsh. I'm just, you know, I want people to succeed, but
Yeah.
for this application, we need to understand what the issue is that you're trying to overcome.
Yeah,
yeah,
perfect.
Okay, brilliant.
Thank you.
No worries. Are there any other questions from anybody? Or did anybody want to pitch? I think there might just be a a silence there.
It's perfectly in on time. It's amazing.
Yes. Okay, I don't think we have any more questions. I just want to thank everybody for coming along this. I think it's Wednesday evening. The weeks are blurring together during this recruitment process. We really appreciate you coming along, asking questions, getting involved, and actually getting to know you a little bit. And a huge thank you, obviously, to Tamsin, who is our co-clinical lead here, an entrepreneur herself. If you want to know more, we did link Tamsin's case study. So here, have a look, everybody. And thank you so much to Emily, who is part of our team, who is an amazing comms officer. Just to let you know, and I forgot to mention earlier, all the work that Emily does actually does get passed on to NHS England, because they're really interested in what we're doing, and they sometimes showcase some of the work that entrepreneurs on the programme are involved with. So a huge thank you for everybody attending tonight. We really want to see your applications. If you come off this webinar and you think, my gosh, I've got another question, please just email us cep@aru.ac.uk. Check out the website as well. And yes, we'd love you to get involved in the programme. So thank you ever so much, and have a great evening, everybody. Thank you.
Thank you.
Thank you.
Thanks all.